Chickenpox is a highly contagious viral disease that primarily affects children, but can also occur in adults. It is caused by the Varicella-zoster virus, VZV, which belongs to the herpesvirus family. While chickenpox is generally mild and healthy children, it can lead to more serious complications in adults, pregnant women, and individuals with weakened immune systems. Understanding what chickenpox is, how it spreads, its symptoms, and how to manage it is crucial for preventing its spread and reducing the severity of the disease, especially in vulnerable populations. Chickenpox spreads primarily through respiratory droplets when an infected person coughs, sneezes, or talks. It can also spread by direct contact with the fluid-filled blisters that form on the skin. The virus can remain contagious from 1 to 2 days before the rash appears and continue to be contagious until all the blisters have crusted over, usually around 5 to 7 days after the rash begins. This makes chickenpox particularly contagious in settings such as schools, daycare centers, and households, where it can easily spread to others, including those who may not have had the disease before or who have not been vaccinated. When a person contracts chickenpox, the Varicella-zoster virus enters the body, typically through the respiratory tract. It then spreads through the bloodstream and travels to the skin, where it causes the characteristic rash. Initially, the rash appears as red spots or bumps, which then evolve into fluid-filled blisters. Over the course of several days, these blisters burst, dry up, and form scabs. The rash can appear anywhere on the body, but it tends to start on the face, chest, and back, spreading to other areas. Along with the rash, individuals often experience other symptoms such as fever, headache, fatigue, loss of appetite, and overall discomfort. While chickenpox is often mild in children, it can cause complications, especially in certain high-risk groups. These complications can range from mild to severe and may include bacterial infections of the skin, pneumonia, or even encephalitis, inflammation of the brain. Children who are otherwise healthy and do not have underlying medical conditions are less likely to experience severe complications. However, for adults, the risk of complications is significantly higher. Adults who contract chickenpox may experience more intense symptoms and a greater likelihood of complications, including pneumonia, liver inflammation, and, in rare cases, death. Pregnant women are also at risk when it comes to chickenpox. If a pregnant woman contracts chickenpox, there are several risks to her and her unborn baby. The virus can cause birth defects in the baby, a condition known as congenital varicella syndrome. This can lead to serious complications, such as limb abnormalities, vision problems, and low birth weight. If a pregnant woman is exposed to chickenpox, it is crucial to seek medical advice immediately to assess the risk to both the mother and the baby. Individuals with weakened immune systems, such as those undergoing chemotherapy, taking immunosuppressive medications, or those living with conditions like HIV/AIDS, are at an increased risk of severe complications from chickenpox. These individuals may develop widespread infections, damage to internal organs, and may experience a longer recovery period. It is important for those in this group to take extra precautions to avoid exposure to the virus and to seek immediate medical treatment if they do contract chickenpox. Immunocompromised individuals are also at greater risk of developing shingles later in life, as the Varicella-zoster virus remains dormant in the body after an initial chickenpox infection. The primary method for controlling chickenpox is through vaccination. The chickenpox vaccine is a safe and effective way to prevent the disease. Since its introduction, the vaccine has greatly reduced the number of chickenpox cases, as well as the complications that can arise from the illness. The vaccine is typically given in 2 doses, the first dose at 12 to 15 months of age and the second dose at 4 to 6 years of age. For adults who have never had chickenpox or been vaccinated, getting the vaccine is highly recommended. The vaccine is especially important for people who have not been previously exposed to the virus and are at risk of complications. The chickenpox vaccine not only helps prevent infection, but also significantly reduces the severity of the disease if contracted. Even if vaccinated individuals do get chickenpox, they are far less likely to develop severe complications or require hospitalization. Despite this, it is still possible to develop chickenpox after vaccination, though such cases are typically mild and much less common. In addition to vaccination, there are several other ways to manage chickenpox symptoms and prevent further complications if someone does contract the disease. First and foremost, the key to managing chickenpox is to control the itching associated with the rash. Itching is one of the most uncomfortable symptoms, and it can lead to scratching, which increases the risk of secondary bacterial infections. To alleviate itching, over-the-counter antihistamines and creams, such as calamine lotion, can be helpful. Cool baths with oatmeal or baking soda can also soothe the skin and reduce irritation. Wearing loose, soft clothing and keeping the skin clean can also help prevent the rash from becoming infected. For more severe itching, doctors may recommend prescription-strength antihistamines or topical treatments to reduce irritation. Additionally, keeping the rash covered and avoiding scratching is important to prevent the risk of skin infections. In some cases, if the skin becomes infected with bacteria, oral antibiotics may be prescribed. If an individual is particularly susceptible to infection or has a compromised immune system, their doctor may also prescribe antiviral medications to help reduce the severity and duration of the illness. Managing the fever that often accompanies chickenpox is another important aspect of treatment. Over-the-counter medications such as acetaminophen, Tylenol, are typically used to reduce fever and alleviate discomfort. It is crucial, however, that children with chickenpox never take aspirin. Aspirin use in children with viral infections like chickenpox has been linked to Ray's syndrome, a rare but potentially fatal condition that causes swelling in the liver and brain. Rest is essential for recovery from chickenpox. Because the disease can cause fatigue and a general feeling of weakness, individuals should allow their bodies time to rest and recover. Rest also helps the immune system fight off the infection. People with chickenpox should avoid contact with others, particularly those who have not had the disease or been vaccinated, as chickenpox is highly contagious. Infected individuals should remain in isolation until their blisters have crusted over to prevent spreading the virus to others. While chickenpox typically resolves on its own, certain groups of people may benefit from antiviral medications such as acyclovir. Antiviral drugs are most effective when started early, ideally within 24 hours of the appearance of the rash. For individuals at higher risk of complications, including adults, pregnant women, and those with weakened immune systems, these medications can reduce the severity and duration of the disease and help prevent complications. Once a person has recovered from chickenpox, they typically develop lifelong immunity. However, the Varicella-zoster virus does not completely leave the body. It can remain dormant in the body's nerve cells and may reactivate later in life, leading to shingles. Shingles is a painful rash that often appears on one side of the body and can be accompanied by nerve pain. This condition is more common in older adults or those with weakened immune systems. The risk of shingles is higher in individuals who had chickenpox at a younger age. In addition to chickenpox vaccination, the shingles vaccine is available for older adults to help prevent the reactivation of the virus. The shingles vaccine helps reduce the likelihood of developing shingles and can also reduce the severity of symptoms if the virus does reactivate. Although shingles and chickenpox are caused by the same virus, they are different conditions, and while one may experience chickenpox only once, shingles can occur later in life due to the reactivation of the Varicella-zoster virus. In conclusion, Chickenpox is a highly contagious viral disease that can cause significant discomfort and complications, especially in adults and vulnerable populations. The Varicella-zoster virus, which causes chickenpox, spreads through respiratory droplets or direct contact with the fluid from blisters. While chickenpox is often mild in children, it can lead to serious complications in adults, pregnant women, and individuals with weakened immune systems. Vaccination remains the most effective method of preventing the disease. And for those who do contract chickenpox, managing symptoms such as itching and fever, preventing secondary infections, and staying isolated from others is key to a successful recovery. Furthermore, antiviral medications and rest can help reduce the severity of the disease and improve outcomes, particularly in high-risk individuals. If you found value in this video, please give it a like and subscribe for more straightforward, well-researched advice on mature health. Don't forget to hit that notification bell so you won't miss our next conversation. Stay healthy, and I'll see you in the next video.